Thank you, Dr. Ankita and Sahani sir. Good evening, good afternoon, and good morning. This is the 1432nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NEHA Kakkar. We welcome all to the session and let us begin the session with 1 minute silent prayer. All of you know that the International Forum for Promoting Homeopathy comprises of homeopathic lovers, doctors, and students. And we have 3 sessions every day from 7:30 to 8:30, the Hindi session, 8:30 to 9:30, the international session in English, and 9:30 to 10:30, local language session in Malayalam. And today we have one of our best moderators of homeopathy, IFPH, that is uh, Dr. Neha Kakkar is our guest of the day, and she has completed her B.H.M.S from Delhi and practicing homeopathic physician, and she is practicing at her own clinic, Homeo Cure and Care Clinic, Meerut, Uttar Pradesh, India. And she is a member of Meerut Homeopathic Medical Association as well as a Red Cross Society, Meerut South Delhi Homeopathic Association, and she has presented various papers and a very interesting paper on the topic of cancer and its homeopathic etiology and management at All India Homeopathic Congress held at Hayat Center, Delhi in 2023. And she has presented so many sessions in this forum. And today, talking about one of the best subjects, as you know, the drug picture of graphites, but what is rare in that, rare, uncommon in the drug picture of graphites. So let us see the picture itself. The subject is titled as The Uncommon Drug Picture of Graphites. So we proudly welcome Dr. Neha Kakkar to this. Welcome, Dr.
Thank you so much, Dr. Dinesh, for the wonderful introduction. It has been a privilege to be associated with the IFPH, both as a presenter and also as a moderator. And it has been a wonderful journey for me. And I hope I continue to be associated with this wonderful platform, both as a presenter and a moderator. I hope I am doing justice to my job. And it's the appreciation of you all doctors and all the audience. So that I'm here and today again I'm presenting. Thank you so much. So starting with the topic, I'm sharing my screen. Everybody can see the screen?
Yes, yes.
Okay. So the topic of today's presentation is the uncommon drug picture of the drug graphites. In this presentation today, we are going to see the drug picture of graphites that is commonly seen and also some of the uncommonly seen presentation of the drug graphites through the presentation of different cases, because cases are the main, the forte of homeopathic practice. They are the things which prove the things which we are going to present or which we are claiming. So the case, with the help of the cases, we will see what are the common symptoms and what is the common drug picture of graphitis we commonly come across, and also what is the rare symptoms if we get them, and how the graphitis drug helps to treat those cases. So, as we all know, the common name of graphites is black lead or amorphous carbon, and graphites is very commonly used in making of the pencil lead. The pencil inside the black material which we see inside the pencil is basically graphites, and also we see use of graphites in batteries, the batteries which we use in remotes and in our clocks and other things, or in AC remotes and other things. Battery has a basic content of graphites because it's a good conductor of the electricity that is coming around. But along with it, it is also a inert substance. Graphites is both reactive and inert in different forms. So this is the basic common name we see, and its different uses in the common day-to-day life. Next, we are going to see that, as I have already told, that we'll see the contrasting uncommon drug picture of graphitis along with the common drug picture. We'll see the contrast which we see. So to see the contrast, first we need to see the what is the common drug picture of graphitis which we come across, and the physical and mental makeup which makes the core of graphitis, that is we are going to see, and this will also help us to understand the contrast with the help of the cases which we are going to see. So coming to the physical constitution of graphitis, the basic element that the Allen keynotes, everybody has read the Allen keynote symptom. We all have read this book in our B.H.M.S classes. It describes graphitis as suited to women who are very inclined to obesity and who suffer from habitual constipation with the history of delayed menses. Whenever uh, we think of graphitis, because in my college time, Allen keynotes were the basic book which we used to refer, and the things which we have read from Allen's keynotes, it clearly describes the picture of the any drug which we are reading. So whenever we read any specific symptom, the first line of the Allen keynotes, the physical constitution or the mental keynote, that portrays a complete picture of that drug. So similarly, in this case, graphitis is described as a woman who is inclined to obesity, is suffering from constipation and with history of delayed menses, and mostly women who are having their menopausal period. Those women are commonly seen to represent the picture of graphitis, which we are going to see further also in the presentation. The other important physical generals of graphitis which we see are the graphitic patient is very chilly. It takes cold easily because they tend to feel cold easily and have complaints like respiratory problems and cold and cough. That cold is easily taken because these graphitis physical constitution is a sensitive one, so they take on cold easily. Next, important physical general, it's a very important symptom of graphitis. That is, it has a unhealthy skin. It whenever you seen anybody if has they have seen graphitis patient, they have very unhealthy skin. Their the skin is very dry. It's cracked from everywhere, and as it's mentioned, it's every injury suppurates the injury. Uh, Even a slightest injury is going to generate pus, or even the pimple formation or any acne that is coming on will produce pus formation. And there is a typical look of the graphitis skin which is cracked, dry skin, unhealthy skin, and it is very thick. The skin is also thick, nails are very thick. So this is the basic picture. Whenever you see graphitis and you are getting the skin symptoms, that can be a keynote or a peculiar symptom to prescribe graphitis. Next, we see that all eruptions of graphitis ooze a watery, transparent, sticky fluid. It's always the pus, whether it's a pus or it's a normal transparent fluid. It is always sticky and uh, चिपचिपा जिसे कहते हैं, sticky fluid होता है, and it's always this character of discharge is there. As I've mentioned before, also the nails are also unhealthy because the skin is healthy and nails are an important part of the skin. So the nails are brittle. Mostly we see brittle nails and thickened and deformed nails in graphitis cases. I also remember a case where I treated a patient of unhealthy nails. I have not included that case here because that needs to be a contrasting session. But I have treated a case where unhealthy nails were treated very beautifully with the case of graphitis. Then there is imperfect assimilation. Here we see similarity to Silicea and Calcarea in graphitis. Graphitis is very similar to Calcarea carb because there is imperfect assimilation, because there is sluggishness system. As I mentioned before, graphitis is both a sensitive remedy and side by side, it's an inert remedy also. Because of its inertness, there is imperfect assimilation of all the nutrients, which leads to this simulation of obesity, and there is sluggishness, delayed menses, and all these symptoms point towards the imperfect assimilation. Also, around the menopausal period, there is this sluggishness cupping, and that is going to the symptoms of graphitis which are presented. So it is very much similar to calcarea and silicea here. And silicea is also a chili remedy. Graphites is also a chili remedy. Calcarea are also chili. So these three, there is always an overlap between these three remedies: silicea, calcarea, and graphite. And sometimes it's get difficult to select the symptom, but we need to see the keynote symptoms and select the remedy. Then there is an aversion to sex, that is, there is aversion to coitus in these graphitis patient. The patient is very much averse to sex, both the sexes, whether a male or a female, they are very much averse to sex, sexual intercourse or sexual activity. Next, the symptom which we see in the graphitis is, as we say in the first slide itself, that is of chronic constipation. The stool is quite hard. There is constipation. There is, again, the sluggishness is coming into this drug picture, where there is sluggishness of the intestine, which is leading to constipation here. Then we have irregular and delayed menstruation, as we have seen already. There is a delayed menstruation, and these symptoms are mostly common around the menopausal period also. So these were the basic physical symptoms which we come across whenever we see a general graphitis patient, and if a female especially is coming to you. So these complaints of constipation and menstruation can be a guiding symptom to select the remedy. And even if it's not a woman, it's a male patient. As I told you before, that I treated a case of nail case. That was a male patient, and he also had fungal infection between the toes and the fingers, and the nails were also deformed. So graphitis covered that case beautifully, and that fungal infection was very much cured with graphitis single. Initially, there was a confusion between natramur and graphitis, but because of the character of the skin, I prescribed graphitis, and the case was healed beautifully. Coming to the mental general characteristic symptoms, which we see in the graphitis patient, we see lot of symptoms here. It's a, as I told you, it's a sluggish remedy. So that sluggishness comes also into the mind level. There is indecision. The graphitis decision, patient cannot make his decision himself. He's always dependent on others for the decision making, either on the husband or any person who is higher in position to them, whether in the family or at the workplace. There is a tendency for indecision. They cannot decide for themselves. Second symptom which we see here is moodiness and irritability. There is a lot of moodiness and irritability, and there is a fluctuation of mood. Sometimes the patient is happy, and the next moment she is crying, and sometimes she is quite in a happy mood, and the next moment she is quite worried. So this contrast is seen. This moodiness and irritability is present there. Next we see is grief and sadness symptoms in the graphitis patient. There is a lot of sadness and weepiness also, as we see in the further in the slide. Grief and sadness is a very important symptoms, and especially around the menopausal stage, we see these symptoms of grief and sadness in the graphitis patient. As I told, weepiness, especially after listening to music. This is a very specific symptom of graphitis, where we see weepiness, especially after listening to music. Next is timidity. The graphitis patient is quite timid in nature and very shy. Here, graphitis is matching along with pulsatilla, because there is timidity in pulsatilla also. And graphitis patients are mostly yielding patients. They are not very, haughty or arrogant or, high on, a type A personality type patient. They are quite timid and easily going patients. Fearfulness is also marked in graphitis. They are very fearful remedies, and because of the fearfulness, there is apprehension also. Anxiety and apprehensions is a very marked symptom of graphitis. Next we see is gentleness and simplicity. As I told you, it's a timid remedy. So we see the symptom of gentleness and simplicity also there in this graphitis drug picture. So it's quite also matching with pulsatilla with these two symptoms. And the last symptom which we see at the mental level is forgetfulness. Because of this moodiness and irritability and the constant mental turmoil that is going inside due to the thoughts that come, especially in menopausal period, the patient will present the symptoms of moodiness, grief, sadness, weepiness, apprehensionness, and forgetfulness. The patient tends to forget very easily. So these are the basic mental characteristics we see in the graphitis drug picture. next symptom that's left is frigidity at work. Frigidity is there at work. She is confused what work she need to do first, and also she is, because of the apprehensiveness, there is frigidity at work because there is constant turmoil going on inside. So the hands and legs don't work, they don't follow the brain, and there is quite, nervousness kind of thing is happening with the patient. So there it brings on the frigidity that is present at work. So these are the mental symptoms. I guess they are not more there. Yes. So I have just, given this cartoon character to the drug picture of graphite here, which we see a obese woman here. And here, this is an old lady who is just thinking about forgetting, because the things she's trying to remember those things because she is forgetful. And there, this weepiness of graphitis is there. And also, because of the you can see here, this a woman with this ticking clock who is experiencing menopausal symptom and this moodiness. So these 3 or 5 pictures, you can see here, represent the graphites, in a pictorial manner. When you can just whenever the patient comes into the clinic, so these symptoms you can find. And I'm not saying that all these present symptoms will be present, but you can see that some of the symptoms will be present in some women, and other of the symptoms will be present in some other patients. So this is the basic picture which we see of graphitis. And now, what are the therapeutic areas? I mean, the clinical conditions in which we can use graphitis as a drug. First is the obviously the climatic complaints. That is the complaint that comes around at the menopausal period. Those are called the climatic complaints. You can have hot flushes. That is a very characteristic symptom of menopause. That hot flushes are coming. There is irritability. There is excessive sweating. But when we see the whole drug picture, we see the unhealthy skin, and we see the irritability, the moodiness, the weepiness, and along with the hot flushes and the menstrual complaints, we can definitely prescribe graphitis. Next, we see the complaints of baldness. Baldness is also excellently covered by the graphitis remedy, especially in the higher potencies, where you can see the bald patches of hair being covered by graphitis remedy. Next, we see it works beautifully in constipation also. Whenever there is chronic constipation along with delayed menses, especially, you can see graphitis working wonderfully. Then we have skin diseases of eczema, that's already mentioned. There is dry, cracked, unhealthy, suppurating skin. Where we see, especially in both, it works both beautifully in the dry eczema cases and wet eczema. Eczema is 2 types, dry eczema and wet eczema. So you can see graphitis working in both the cases. Then there is cases of acne around, especially in the women. We see acne complaints coming up due to sluggishness of the mucous membrane. So you can prescribe graphitis here also. Then we have postular eruptions, as we saw before. The pus formation is there, and there is sticking discharges in the skin complaints. So you can prescribe graphitis here. We have good results in fissure in anus. When there is fissure in anus, it's a condition where there is dryness of the anus, and there is chronic constipation, which can lead to cuts in the anus or fissures, and their graphitis also works beautifully. Then in irregular and scanty menses, sorry for the spelling here, EIREE. It's irregular and scanty menses, and it's there also graphitis gives us good results. Then warts and corns, also graphitis works beautifully. Overgrowth on skin. So warts and corns are also a part of overgrowth on skin, or any skin tags you see in the skin, that can be also covered with graphitis very well. And also in the, as I told you, nails deformities, graphitis works well. Here it's coming up. Nail disorders, graphitis works beautiful. So these are the conditions which we normally give graphitis in the picture. And now we are going to see the cases which we are going to see the contrasting picture coming up. In the case one, I'll take up the general drug picture of graphitis which came up, and I prescribed graphitis on that basis. So this case one, we see the presenting complaint of a 30-year-old female patient coming up with complaints of delayed and scanty menstruation since past 6 months. She visited my clinic on 12th March 2022, and she also complained of acne on her face, which had reddish margins and were pus-filled and blood-filled. She had a very, very unhealthy face, and also she had complaints of delayed and scanty menstruation. So this is the basic complaint she came up with. But as she came up, she was more concerned with her face. She first complaint she mentioned was of delayed and scanty menses, but the more concern of her was on her face because she was a beautician. She was running a beauty parlor, so she was more concerned with her appearance, and that acne was filled all over her face, on the head also, on in the cheek area and in the neck area also. So she was very much concerned with her face. So coming to the history of presenting complaints, the patient started having irregular periods since past 6 months. Bleeding in periods gradually decreased in quantity with every upcoming period. Also started to have complaint of acne on her face. Started as a small reddish eruptions and turned into pus and blood filled acne. They were also painful and left a scar when healed on the face. So the pimples were leaving a scar. So you can understand why she was very much concerned for her face, because the pimples were leaving a scar. Both the complaints started simultaneously and gradually increased in intensity. She was bit mentally tense about financial matters of her home during the onset of her complaint. So in that history she mentioned, I asked her why, when is the time period she started to have her complaint. So she mentioned that she was worried about the financial matters that were going on to her. There was a financial crunch at her home, so during those time only these complaints started coming. So there was a mental reason for those complaints that were coming up. So, seeing the personal details of the patient, she was a 30-year-old female patient. It had two children and she was running a beauty parlor, as I told you before also. So coming to the physical generals, her appetite was normal, thirst was normal, desire for fatty and oily food were there, no aversion. So the desire for fatty and oily food was there, sleep was normal, perspiration was scanty. The perspiration was scanty. There was no perspiration at all. कि पसीना बहुत ही कम आता डॉक्टर साहब, ज्यादा पसीना नहीं आता है. Or stool was constipated, sometimes skipped stool. Passing stool when passed was hard. So she had hard stools and was generally constipated also. Urine was normal. And looking at the mental generals, we see that she was a mild and sweet natured lady and did not get angry often. She was very easy to get along with, and she talked very, very sweetly. And at home also, and with her, people who were coming to her beauty parlor, and even with her family member, she was not very easily, irritated or angry. But when hurt would go into weeping spell. Whenever she felt hurt, she would start crying and weeping, but she did not cry in front of me. But she was, uh, concerned whenever she got something hurt on her feelings, and there was weeping thereafter. Recently, since last winter, she had started getting irritable on the children. Since the onset of the complaints, the irritability had come up. Since the complaints were there, there was delayed menses and acne was coming. So there was marked irritability was coming up. Because although she was not angry often, but sometimes she used to get irritable since the complaints had started. She depended on her husband for all her important decisions. So the indecisiveness of graphitis we can see here. She was dependent on her husband for all her important in spite of being a financially independent lady, because she was running a parlor. She was dependent on her husband for all her important financial and even the small decision that used to take for her home or children. She told that she used to take them with her consent of her husband. She used to get anxious if there was work that was not easily manageable. So if there was, a lot of work stress that was going on, so she used to get anxious due to the work stress. So these are the mental and physical symptoms which we came across in this patient, and was very much conscious about her look. As you can see from the symptoms itself, that she was very much concerned about her looks, and the acne was, disfiguring her the face, and was leaving the scars on the face. So in the menstrual history, she had irregular menses since 6 months. Discharge of blood had drastically reduced since last 6 months. Bleeding was very scanty and brownish in color and also offensive. No leukorrhea was there. Two children born by normal delivery. No history of abortion was there. So there was irregular menses and it has constantly increased in quantity. Past history of allergic reactions 2 years back got subsided with allopathic vision. There was history of allergic reactions. So she had a history of skin complaints coming up here, and a history of typhoid in childhood. Family history had diabetic mother and hypertension father. Physical constitution, obese and fair looking, flabby constitution. So when she came into my clinic, I was confused because both graphitis and calcarea, more she was inclined towards the calcarea carb group. And we'll further see in the case why I chose graphitis. And in the physical examination, we see pulse as 75 minutes, BP was normal, pulse was normal, but she was a obese, fair looking and flabby constitution. There were warts also on back. So skin complaints are, ruling this case. We have allergic reactions history, we have acne coming up, and we also have warts here. Investigation done, the ultrasound revealed normal investigations. And coming to the reportization of the case, here we see uh, there is skin eruptions, and here we see more of pulsatilla also coming because of the mental symptoms. Because there is, I told you that it's graphitis is commonly confused between calcarea and cilicia, and on the mental level it is confused with the pulsatilla. So here we see in the repertorial analysis, we see pulsatilla, but as we look at the patient, we see more of calcarea carb also coming. So this was the repertorial analysis that came up, and the remedy that I prescribed. Graphite was selected as prescription because the totality was pointing towards calcarea with the mental picture of mildness, moodiness, indecisiveness, and weeping, also with physical journals of unhealthy skin, constipation, and physical constitution of fat, fair, and flabby. Here, pulsatilla was not selected because the patient was not thirstless. So, why I did not choose pulsatilla? Because there was no thirstiness. The thirst was normal. She had normal thirst and was more of irritable than the pulsatilla. Recently, because of her complaint, she has turned more irritable and she did not weep in front of a pulsatilla patient is a patient which might weep in front of you and has more frequent weeping episode, and thirstness is marked in pulsatilla. So also calcarea carb was not selected as calcarea is more obstinate in nature along with perspiration more on head. As we had scanty perspiration here, so calcarea was not selected. Calcarea has more perspiration on the head and gives a picture of defective. Now this defective nutrition is there in graphitis also, but calcarea gives. But I cannot say I prescribe graphitis because of the predominance of the skin symptoms and also because of the mental picture that was also matching. There was a confusion, but finally I gave up for graphitis because of the skin symptoms. So here we can see in the complaints, graphitis 200 OD days, daily empty stomach along with placebo for 15 days were prescribed. Again, the follow-up on 27th March, there was no relief in symptoms. Graphitis, OD dose, daily empty stomach with placebo for 15 days was again prescribed. And sorry, just a second. And there was, so after the second prescription, we see there is a relief in acne. There was a relief in acne, and the patient saw relief in the eruptions. And after this, there was less frequency of eruption. After the second prescription, first on 12th March, there was no relief on, but after 27th March, there was a relief in acne and less frequency of eruption. Placebo was prescribed for 15 days. On 27th April, again, she came back and she said that acne were quite better. Now this patient, gave me a wonderful review on my Google page. I did not include that picture here because I did not have the time, but she gave me a Google review that acne had quite relieved after the medicine, and she was quite thankful that her acne came down because she was very much worried about her acne and no new eruptions starting coming up after the prescription. So the acne was 60% better, and again I prescribed only placebo for 15 days. But on the next visit, there were new eruptions again. But the periods came up and the flow was better, and they also came on time. So there were no new eruptions coming up again, but the periods came out. So this was also a good symptom, because the complaints were, slowly coming up, and they were this coming the superficial symptoms, and slowly the remedy was working in the core, and it also touched the the pituitary axis that was responsible for the periods. So the periods came up. At this stage, I prescribed sulfur 200, that is intercurrent dose, followed by graphites 200. I always give intercurrents in between, because they act as a, anti-psoric or anti-syphilitic or anti-psychotic, whatever the miasm that is there in the background. So we need to see the miasm here. So the drug picture was mostly of a miasmatic, psoric miasm coming up. So I prescribed sulfur 200, and that always boosts the remedy which we are giving up. So I prescribed sulfur 200 and that anti-miasmatic. After that, I gave graphites 200 again. Now, next on 27th May, there was again no new eruptions. The face was very clear. Patient herself was very satisfied with her face. She was very much satisfied with her face, because that was her core complaint. And after that, placebo was again prescribed for 15 days. After that, on 12th May, second cycle of periods after the medicine came up, and time and flow was very much better. Phase were better by 90%, and it was very much. The phase was transformed, totally on a very good plane. She had a very good skin otherwise, and she was very much happy with the results. And she was not much concerned with the periods of her, but her face was a lot better, and she was very much satisfied with. After that, for 1 month along, she came for the medicine again, but I prescribed her placebo, because her acne was quite better. So in the period between 12th March, so in 3 months, her acne went away with the prescription of the graphites. Now here we see that graphites worked on the general drug picture here. Now next, in the cases, we will see how the graphitis was not presenting up, but how, in a rare symptom, on only a rare one or single two symptom, we prescribed the graphitis in this case. Case 2 will illustrate the how, when we presented with an uncommon picture of graphitis, still brings about the cure. The patient did not present with a conventional picture of graphitis, but gets cured with it. So in this case too, a patient presented with complaint of keloid growth in the right breast near the areola region of breast. The growth was approximately 6 centimeter in size and was circular in shape. No other specific. There was a keloid near the right breast in the areola region of breast. And in the history of presenting complaint, we see the keloid growth was present since past 1.5 years, and the patient had not taken any medicine for it. It had gradually grown in size in the past 1.5 years. The first, it was a very small keloid, around 5 to you can say around 10 size of that keloid, but slowly it had grown gradually in size, and she did not take any medicine. And it was sometimes painful also. The patient was advised removal of this growth by surgery, but the patient did not wanted to have surgery for this sensitive region of breast. She did not wanted to go at surgery. Obviously, the allopathic system of medicine, whenever there is an overgrowth, they always go into advice for the surgery. But the patient was not interested, because it was a sensitive region, and otherwise she did not wanted, her breast to be manhandled, malhandled. So she did not opt for the surgery, and someone advised her that you can go consult a homeopathic doctor. So she came up to me for the homeopathic consultation. So here the physical generals for appetite, thirst were normal, desires and aversion not specific. She mostly ate health consciously. So stool was sometimes constipated, could not pass stool properly. Urine was normal, sleep normal, dreams were nothing specific. Mental generals were very fearful to get some incurable disease. She was very much fearful about this growth also, कि ये cancer बन जाएगा. It will convert into cancer, because this is a growth there, and it has gradually grown in size. So she feared that this growth will also turn into cancer. So this was the basic red line symptoms of the case, that she had fearful to get some incurable disease. Was irritable when someone did not understand her. She was a homemaker, so she was responsible for the joint family and felt frustrated sometimes. So she was sometimes frustrated because of the family pressure, but was very much attached to her children. Was very irritable when someone did not understand. So here we see these are the, I mean, these things come commonly whenever the person is living in a joint family. You tend to feel frustrated. So she was only the basic thing that was covering her mental symptom was this fear of this growth. Past history, there was nothing specific. Family history of hypertension in father and siblings. Examination of keloid, that is the thing which we was a circular growth with hard margins and also gave puckered appearance to the breast. So whenever I examined the breast and we see that keloid was there on the left side, and there was it near the keloid area, it was coming up as an overgrowth there. So I examined and it was quite hard in nature. So here we see complete, as we see, I have used this Zomeo Pro software for this case also. We see fear disease of incurable being. So we here see calcarea carp coming up at the top, and also nitric acid is there. And next we see phosphorus, nitrosis, fluoric acid, and silicia. Silicia is very commonly used for keloids, and it's a very commonly chosen graft if we think of as a keloid growth. So silicia is commonly, you know, taken up. But here, because of this fearful symptom of incurable disease, and that calcarea has this great fear of incurable disease, I prescribed calcarea carb for this complaint. And we see on basis of representation, I dose up calcarea carb 200. That was daily dose for 1 week, then followed by placebo for the next week. On the second visit of 5th February, there was no change in growth. Previous prescription was repeated. And at the third visit also, there was no change in growth. So I went up for calcarea carb 1M because the mental symptoms were coming up, and I was sure that she would get cured with calcarea. I had this basic coming up because this symptom of incurable disease was, hitting in my mind that calcarea is going to cover up this case. And otherwise also she was a chilly patient. She said कि मुझे ठंड ज़्यादा लगती है, गर्मी इतनी नहीं लगती है. So I prescribed calcarea 200, but that also did not give. So I opted for calcarea 1M then. On 4th visit on 6th March, she was coming up, in 15-day period. And there was no cheese in growth. Again, I prescribed calcarea carb 1 for single dose for 1 week. 5th visit on 20th March, no change in growth. Patient was worried that growth might not get cured. So this symptom of, again, it was troubling her that this growth might not get cured. But again, case was reanalyzed and I started with silicia 200. So here I changed the remedy because calcarea carb was not working. 200 I gave up, and for after 1 month also there was no change, and then after that 1M, and the patient was getting impatient ki doctor sahab ye theek kyun nahi ho raha hai. So I again analyzed the case, and for keloid I started giving silicia 200. It has affinity for keloid, and there is stitching pain in keloid. Stitching pain is also there in silicia, so I prescribed silicia 200 here. Next visit, there was slight softness of growth, but there was no change in the eye. Only the softness, that means the hardness of the growth converted into softness. And but there was no change in size after this. So the same prescription was continued for 1 month. And in the next visit, there was no change in size of growth, but growth was now only softer. Now I again analyzed this case, and nothing was coming up. I thought of carcinosin here also, but because there was no history of cancer. So we see again, as we go to the repertorial chart here, we see calcarea, nitric acid, carcinosin also coming up here with 19 totality covering up, phosphorus also. But she was not a phosphorus patient because phosphorus patients are very mild nature, and they are different. Phosphorus, as you see, there is discharges also there in phosphorus. She's very intellectual cases of phosphorus. And whenever you see a phosphorus patient, he is a more of intellectually inclined patient. So here I did not thought of phosphorus. And carcinosin also have some suppressions there, but she did not have any specific suppressions here, any mental symptoms that covered carcinosin. So again, I started to go with graphitis, because graphitis also has this fearfulness and apprehension of diseases, though it is not covering here. So you can see the basic mental symptom is not getting covered, only anxiety is getting heavier, and keloid also we see only one mark of growth in there in cataract. So it was a more of a cataract growth here. So, but I still went with graphitis here. So in the next follow-up, as we see, graphitis 200 was prescribed daily single dose for 1 week, followed by placebo for 1 week. Follow-up after 15 days, keloid growth started reducing from the right margin and appeared smaller, and also was very much softer than previous. Same prescription was repeated for 15 days, and follow-up after 15 days were done. Keloid reduced up to almost half in size. So we see that graphitis is working here. Even the best selected remedy did not work here. Calcarea did not work here. Even silicia did not work here, though the symptoms were pointing towards more of calcarea carb. So, but graphitis was chosen here, and because of that one symptom of fearfulness, that I guess that why also sometimes it's wonderful to see how homeopathy works. Sometimes only single symptom leads to the some remedy, and sometimes even after that full simillimum is packing, sometimes that remedy also does not work because of some blockage that is coming up. So graphitis covered this case. This is purely experience. I was quite surprised also myself that why did graphitis work in this case and not calcarea, but that is how come, and I thought of to take this case especially here. Then this placebo was prescribed again and follow-up. So keloid was reduced by 70%. So we see that the drug indicated failed to respond and graphitis gave the desired result. Maybe reason being the next best remedy. Patient had lesser symptoms of the full picture but matched the disease condition and thus gave result. So we see the best remedy did not work, but graphitis worked. So sometimes it's just pure experience in homeopathy that gives us these kind of cases. And right now also I am having a case of nasal polyp, and that patient was having aggravation in rainy season. And she had he had also joint pains and other complaints of dulcamara matching with them, but dulcamara is not working in that case, and the drug that is working is some other drug. So we sometimes see these kind of experiences coming up where the general drug picture is not coming up. So, but we need to take these cases specially and write them down, because these also form a part of our experience journey with homeopathy. Next, also case 3, we see a typical case where the common drug picture of graphitis is not coming up, but we see that this case is also getting cured with graphitis. Now, this was a male patient. Now, as we told you before, that graphitis is more of a female remedy, but this was a male patient that came up. Male patient age 16 years came into my chamber with basic complaints of pus-filled acne on face and back, chest, and thighs. The face of the boy had changed color and has become very darkly pigmented due to acne. This was the primary complaint. There was a lot of acne on his face, and the skin had discolored and turned blackish due to this complaint, and Timur was very much concerned for his face as he's studying in 12th standard, and he felt shy in front of his friends and school group. Obviously, whenever a teenager gets things on his face, they are very much concerned about these appearances. So and his face was very much I would say just converted to like dark charcoal. He had not a very good complexion, but he was almost covered his face. All the back pigmentation was here below the eyes and on the forehead also. So coming up to history of presenting complaint, the problem of acne started in the year 2020. So it was a quite back, and then his acne started as small bumps and then converted into big acne, which were pus-filled and gave a very dirty look at the face. The patient took off on and off allopathic medicines, mainly antibiotics for this condition, but the relief was very temporary, and the condition worsened, leading to scarring and blackhead pigmentation on his face. Also, the acne keep coming up every now and then. Matlab scarring and black pigmentation there were acne was again leaving the scars here, and pigmentation was there was a lot of acne on the back also, and they came coming up very frequently, and he took allopathic medicine, mainly antibiotics, but obviously antibiotics gives very temporary result and they keep coming back again and again. boy was also frustrated with taking medicine. He was, fed up to take medicines because he had taken a lot of antibiotics and still his face was still the same. So he was very much not interested in taking any more medicines. He was studying in 12th standard, and in looking at the physical generally, he was desire for spicy and chatpata foods. Pickles was 3 plus. Non-vegetarian food was his constant desire. He used to eat a lot of non-vegetarian food, and especially after eating this non-vegetarian food, he used to get these acne pus-filled boils on his face and also on his back. His mother came up with the patient in my clinic, so she constantly that he's very much fond of non-vegetarian food, and after taking non-vegetarian food, he comes up mostly of these complaints of acne. So on the first visit, the patient appeared a normal 16-year-old. His only concern was his face. He told that he was averse to washing face, was also taking bath. So he was averse to washing his face and also taking bath. So this was a quite a peculiar symptom here. On probing about his nature and other mental traits, he did not divulge any important details. He was not willing to be probed. He was, very much concerned कि डॉक्टर साहब बस मेरा आप मेरा पिंपल देख लीजिए मेरा बाकी सब ठीक है आप और कुछ मत पूछिए मुझसे. He was not willing to tell me. So only the physical part of the problem was there. I did not get to see the mental part. But later in the case follow-ups, I came to know more about him from his mother. Mother told me that he was a very shy-natured boy. He rarely shared his feeling with anyone and only told important things to his mother. He only shared his things with his mother. That also sometimes, not always. And he was a very shy-natured guy. He was a very responsible in compared to other teenagers and also had a very helping nature. So his mother, started opening up the layers of his mental picture here. And to compared to other teenagers, he was a very responsible child. Did not have many friends. He seldom got angry and was sweet speaking. His father was a very strict disciplinarian person and was very fearful of him. He was very much fearful of his father. Only shared any details with his mother. So in front of his father, he was quite, always quite up and did not divulge. He was his father, only as his mother told me that his father used to only inquire about his studies and what kind of behavior he was behaving in school and did not share an emotional bond with that person. Only emotional attachment of him was with his mother, and he seldom got angry or was very sweet speaking. He also sometimes lacked confidence in himself as was constantly nagged by his father. So his father used to constantly nag him ki aap padhte nahi ho, you don't do this well, you don't behave well. So this lead to lack of confidence in himself. So this was the mental symptoms I came to know about him. Past history revealed repeated bronchitis in childhood. He had repeated bronchitis in childhood. Family history of acne in Bua and maternal aunt. I mean, he had a history of acne in his, family also, where his maternal aunt also had these dirty acne on her face. Physical examination, it was very much visible here, so there was no need of any examination. I did not check the vitals here. Because it was a young teenager, so I guess there was no need for it. And this case, it was coming up from a known to person to me, so he was kind of friendly environment where, so I just take up these details, and later in the case I talked to his mother. I came to know about the mental generals. So first, as we see the I took up the case here, and we see here sulfur, hypersulf, anti-food, and all the other remedies is coming up because of the aversion to bathing and food, pickles, and desires that were coming up here. So on these cases, initial rubrics that were taken were based mainly on the physical symptom, no mental symptoms available. So I started the case with antim crude 200 single dose in the morning, followed by placebo for the next week. She was advised to stop non-vegetarian food. I advised him to stop non-vegetarian food because obviously it was leading to his acne, and whenever there is some dyscrasia in the blood, there is this coming up dyscrasia in the blood that leads to fibromyalgia. So I advised him to reduce his consumption of non-vegetarian food and started with anti-crude based on the basically on the symptom of desire for pickles and also averse to bathing. But there was no improvement in any symptoms. Anti-crude 200 again was prescribed. we need to, sometimes repeat the medicine again, because sometimes we see the remedy is not coming up, but we still need to, repeat, because we need to give the remedy the time to act. So again, I prescribed antimcrude 200. So initially the patient was not coming with the mother, but later on he came with the mother. So then only I came to know about the mental picture. And whenever I take these mental with this, then I took up the whole case and I considered the mental details of the patient also. And after reading the mentals, I was, reading the constitutional book for Philip M. Bailey book on homeopathic psychology, personality profiles of major constitution. This is a very wonderful book for mental remedy pictures. So this book by Dr. Philip is, must read by every homeopathic doctor, I would say, because it gives a beautiful different picture, a rare drug picture of the any drug which we are reading. It has almost around 30 to 30 remedies of our various remedies which cover mainly our materia medica, mostly the multi-layered drugs like nux, pulsatilla, calcareas, and graphites. So here, after reading, I came to know that graphites has, covers this. It has a very rare symptoms, that too especially in males, where they have lack of confidence in them. They don't present a general picture of graphites, or fat, fair, and flabby, but they have a picture where we see there is low self confidence. When you read this graphites remedy in this, you will find there is low self confidence, and they are very timid males. We rarely see very timid males in a, general society. So but the graphitis male is very timid, he is very shy. So same thing was there in this teenage boy also. And also he was very much, lacking confidence in himself. So these things match with the rare duck picture which we see in the male patients of graphitis. And they tend to become very good partners, because they, they become emotionally bonded with their partners, but inside they are lacking in confidence. So these things led to the prescription of graphites here after studying this constitutional rare remedies here. And I prescribe here graphites 200. So after graphite, there was better in growth of acne, eruptions had reduced in severity. Patient was happy that medicine had started working. I had no issues in taking medicines. So he was quite happy here. He started taking medicines again, because he, trusted me that he might get okay. And there was better in acne growth here after graphitis. And again graphitis was prescribed for 1 week, followed by placebo. Now on 13th bath, there was no new eruption. Face was looking better, but the pigmentation was still there. So the mother also came out and she see that everybody is saying how his face had got better now. And even after eating now non-veg, even if even is taking up non-veg, there was no complaints of acne coming up here. There was no acne even coming up after consuming non-veg. So again, placebo for 15 days are prescribed. So graphitis here was working. Then so we need to give the remedy to work here, time to for the remedy to work here. So I prescribed placebo again. Then on 30th March, we have eruptions. Frequency is considerably low, and now appeared as the only small bumps. So only small eruptions were coming up now. Now at this stage, I prescribe tuberculum 200 as an intercurrent. As I told you before, I always prescribe an intercurrent as an anti-miasmatic drug. So I prescribe tuberculinum 200 because of history of bronchitis was there, and more of psychotic nature of the behavior of the patient, because he was, in under confidence and under, shy nature, and not expressing herself. So that's a psychotic trait, and tuberculinum is a very good obviously a tubercular remedy, but also a psychotic remedy. So I prescribed tuberculinum 200 here. And after that, no new operations, but pigmentation is still there. This patient is still coming up with me, but the pigmentation is a bit there. But now the pigmentation is also better now, because in between there was a break in his treatment. He went away to other place for, some examinations, and so there was a break in this treatment. But again, this patient has started coming up in, in around in June. And now I have prescribed berberis also
Dr.
in.
Neha,
Yes.
Dr. Neha,
Yes.
just only 3 minutes. We can conclude the session.
Yes, sir. Sir, only 2-3 slides are left, sir. Yes. So next, you can see in April also, there was quite relief in the symptoms, and only oral medicine was stopped, and berberis aquifolium gel was coming up. He visited me in May also. There was a break after May. There was a break, and the face was 75%, 70% better, and he was very much satisfied with the treatment. So in these cases, as we see, there was a difference in the presentation. The normal drug picture of graphitis was not there, but we see that graphitis worked beautifully in spite of being not indicated or being indicated in a very rare on a general manner. So I would advise every doctor to read that book by Dr. Philip M. Bailey, which provide you a different drug picture, a rare drug picture. So that was all for today, and thank you very much for
Thank
listening.
you, Dr. Neha. It's really a wonderful session, and all the cases you shown were really brilliant, and you have shown the beauty of homeopathy because not only by simply stating what is the drug picture of say graphitis, but instead you come up with some 3 cases in a short time, and that too with all scientific because you have shown took the case in detail, and then you find out the correct symptoms, and then you went up to repetition, and then you got the remedy, then you choose the remedy. But even in the first case, there was a little bit of confusion for you that because there was a competition between pulsatile and graphitis, but in the end you came up with the right remedy, that is the graphitis, because the graphitis being a chilly remedy, you can easily differentiate it from natramur, because the natramur is a hot remedy. It's a very, very hot remedy, just like suffer, but there's certainly at the same time the graphitis is a very chilly remedy. So in those cases, these are the you can take the eliminating rubrics in
Yes.
emails also. But in the second part of the session or second case also, there are you have to change the remedy frequently, but of course sometimes there may be confusion because of the lack of communication with the people, the patient. You may find it very difficult to choose the right remedy. But all in all, you reach the graphitis in the last part itself, and that made the wonderful cure for the patient. And the last case also. But nobody think of this graphitis for this acne and all those things. But the people believe that graphitis may aggravate the situation. There is a false thought among the doctors that the graphitis may do more harm than good, but it is not so. So all the cases you presented in this evening was really enjoyable, and we really enjoy the beauty of homeopathy. And I invite Dr. Shaji Kudiyat to say a vote of thanks to the session. And Dr. Shaji Kudiyat, our Vice President, is here watching your session.
Okay.
Unfortunately, we could please unmute, Doctor. Please unmute. Since it would have been better, you could present 2 cases, then we could have more time for discussion. Unfortunately,
Yes.
it was
Okay.
yes, Dr. Shaji Kudiyat, Vice President.
Yeah. You expect me to explain our problem in the English session?
Yes, you. I know you. There is. You can say something about Dr. Neha's presentation.
Oh, sorry. I was actually simultaneously attending another meeting with the Mullaperiyar Dam. So,
Okay. Okay, no problem. I can directly go for another person. Dr. Padmapriya, if you are there, you can, Dr. Padmapriya, please make your assessment, and then you can go.
Dr. Neha, that was a very wonderful presentation. Thanks a lot. And I do expect to listen more from you because
Okay. Thank you so
with the
much, ma'am.
changing era, we
Yes.
need more constitutional prescriptions with more chronic ailments coming up. We need
Yes.
more constitutional prescriptions. And as you rightly suggested, we need to reckon our knowledge to the great giants of philosophical knowledge been imparted by homeopaths like Dr. Philip Bailey. So please do come back with more presentations, with more recommendations for great books as well. So
Yeah.
thank you very much on behalf
Thank you
of
so much.
our
Thank you so
IFPH
much, ma'am.
team.
Yes. Thank you.
Thank
I
you.
appreciate. Yes.
Thank you. Bye.
Bye.
Thank you, Dr. Neha,
Yeah.
Dr. Padmapriya, and those who attended the session. Tomorrow we will have a session from Dr. B.R. Bindu. She is one of the expert in the management of autistic spectrum disorder. And tomorrow she will be taking a session on homeopathic treatment in neurodevelopmental disorders and sensory integration, part 1, that is autism spectrum disorder. With that, we come to the end of the day, 1432. Thank you all. Good night. It's over to Dr. Mariamma John to moderate the Malayalam session.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം.